a virtual international conference, and with so much of joy in my heart, I, Dr. Isha Trivedi, welcome you all on behalf of Magical Formula 2022 and its team. This conference, as you all know, is unique and hybrid, which aims to bring out magic in new non surgical interventions and implementing them across the globe. Last year, this conference was virtual in 12 plus countries, and this year it is crossing 20 plus countries, which is huge indeed. Pre-COVID times, the importance of virtual connections were less, and we had to refuse lot of attendees as the hall capacity was of only 400 people. And now, believing in India's theme of Vasudhaiva Kutumbakam, one earth, one family and one future, here we are with Magical Formula 2022. Without taking much of your time, I would like to invite Dr. Mohal Banker, our proud host, to share his journey of professional career.
Thank you, Dr. Isha, for nice introduction. I welcome you all in this Magical Formula 2022 live conference. And we have given tremendous response for this conference and registration from more than 20 countries. And we are really excited to deliver our academic work. And let me share my journey first. So in the different part of career, I have taken many risks. And whenever I take the risk, I have one thought in my mind. It's a scary. So why the risks are scary? Because risk means sacrificing your time and energy, and we don't know that we will get a reward or not. Reward in the sense of I will fulfill my need, I will fulfill my desire. I don't know whether this risk is fulfill my need or desire. So I always ask myself that are my sacrifice worth it? And let me show you which risk I have taken in my career. So I have started as a diagnostic radiologist practice in 2001, continue up to 2007, and started my private practice into the same area. But my private clinic was surrounded by urologists and nephrologists, so most of the work was from these feeding consultant, and work is limited to nephrology, kidney, prostate, and all these urologies, pathology. So I feel a little bit bored, and whether I put a very good diagnosis, but always credit goes to surgeon, because patient recognize the treating surgeon, not the radiologist itself. And it felt boring to me. So one fine day, I asked myself, can I do this for my entire life? My inner voice said no. So what to do the next? So I have to take the U-turn in my career and start something new, and which is really scary for everybody, because I have taken so many loans, and I have one child to feed at my home. My parents has different needs, and in all this scenario, if you take a U-turn and start from scratch, it's not an easy thing. And most of the time, people are afraid of the taking risk at this same point. But ultimately, I've started the new thing. I've taken this U-turn and done something new. So first case I've done for varicose vein in 2007, and later on I started my practice as an intervention radiologist. And people told me that you will not survive, but I will survive. I have some instinct that I will survive. 2009, I purchased the first radiofrequency ablation machine for the varicose vein, and that is first in Gujarat. And later on in 2011, this is a gentleman, Dr. 𝙀𝙧𝙩𝙚𝙪𝙡𝙀. I came to know in one conference that he's very good for treating the lymphatic edema, and he has invented the new treatment called silicone tube implantation for lymphatic edema. I invited him, and we have started lymphatic edema treatment into the Ahmedabad, but I was failed, because he's from Europe. All the data is from the Europe, and the hygienic condition, European climate is different than our Gujarat. our patients are not maintaining so much hygienic condition for the leg, and that's why our post silicone tube implantation into this leg, there are heavy incidents of infection, and then we have to remove all the silicone tube. And this was the first failure which I faced in 2011. Then in 2013, Professor Paul Zamboni and he suggested the new treatment for multiple sclerosis, and that is based on increased cerebral venous pressure. And if you put IJV stenting, or if you do the balloon plasty for IJV, it will dilate the jugular vein and it will reduce the pressure, and it will reduce the symptom of the multiple sclerosis. So we have done the couple of cases, but again it was failed because the hypothesis, which is based on increased intracerebral venous pressure, it is wrong. So then come in 2017, there are lots of vascular malfunction patients comes to me, and there was no specific treatment for vascular malfunction, whether you inject the sclerosant or glue, but it is a temporary effective because it just blocks the lumen, but the nidal part is still active. And surgery is not always successful because vascular malfunction itself is very embedded into the normal structure. So it's not possible to remove an entire lesion into the one sitting, and that's why I just search it out. Dr. 𝙂𝙚𝙚𝙚𝙚 is a pioneer for absolute ethanol embolization for vascular malfunction treatment. I went to USA, I learned from him and started doing the practice over here. And right now we are doing lots of cases from entire India. Then in 2019, the new technology came, the Vinasil for the varicose vein glue, and we are the first one to adopt this technology. And in 2020, when the whole India is into the lockdown phase, and we were literally free, and at the time I come to know about this interesting tweet from the Dr. 𝙂𝙧𝙯𝙧𝙯𝙪 from Japan, and he has found it out that into the joint, into the arthritis, there is a chronic inflammation going on into the joint, and there is a 𝙂𝙚𝙗𝙪𝙡𝙀 blood vessels, which is abnormal blood vessels, which is releasing the cytokines, inflammatory chemicals. And if you block these 𝙂𝙚𝙗𝙪𝙡𝙀 blood vessels, then you can reduce the chronic inflammation within the joint, and it will reduce the pain. And because of this my Twitter addiction, I find this new technique. Then we dig it deeper and deeper, and Genicular, we come to know about this Genicular Artery Embolization. And then me and Rosil have done the first case of India, and later on also done for the shoulder, heel and tennis elbow.
We got the contact to come here. Number one, we have actually come here. We came here for the surgery for embolization and varicose veins. We got the message through social media, and a friend of us also just gave us a small clip of Dr. Mohal Banker and what he does. We were actually blessed. We were lucky that we got that contact, and then we came here to Ahmedabad and we came to AIIMS Hospital. It was just amazing. They gave us the treatment of celebrities. I was actually shy about it. It's just fantastic. My special thanks to Miss Yashri, and then Miss Ami. They are two very supportive staff, and they did a fantastic job. I don't have any words to thank them. Dr. Mohal Banker is a gem of a person. He's a doctor who has got magic in his hands. In fact, he has cured my wife within 2 days without any pain or anything. She's now back to normal, walking like a young lady. That's it. And
thanks to Dr. Mohal Banker also.
And to Yashmi.
All the staff.
All the staff, they're all very
supportive and everything. The services they gave. I'm really blessed.
હું ચારુ લતા ભટ્ટ જજીસ બંગલો અમદાવાદ રહું છું અને મને ટીચરમાં લગભગ 10 વર્ષથી બંને ટીચરમાં દુખાવો હતો અને ડાબા પગમાં 2 વર્ષથી વધારે હતો. પછી મેં મારે રિપ્લેસમેન્ટ તો કરાવ્યું નહોતું, એટલે ફેસબુકમાંથી મેં આ મોહલ સરનો વિડીયો જોયો અને મેં આ પ્રોસિજર કરાવવાનું નક્કી કર્યું અને એમને એપોઇન્ટ કર્યા. એમણે બી પ્રોસિજર કરાવવાનું કીધું અને મેં પ્રોસિજર કરાવી અને આજે મને લગભગ મહિનો થયો પહેલા મને ઘણો દુખાવો હતો, હું ચાલી નહોતી શકતી, પીઠણ દુખતો નહોતો મારો. રાત્રે સૂતા પછી પથારીમાં મને બેસી રહેવું પડતું હતું અને 2-4 કલાક કોકના સપોર્ટથી ચાલું પછી મને સારું લાગે. અત્યારે મને લગભગ ઘણો 80 થી ઉપર વધારે ટકા મને ઘણો ફરક છે અને આ મોહલ સરને હું થેન્ક.
So basically, we found our magical formula, and these are patient's word that these are really magic for us. Without any kind of operation, our knee pain and shoulder pain and other leg pains are disappeared. So till now, we have done me and Rosilla have done more than 500 joints for this Japanese treatment since last 2 years, and more than 12,000 procedures for varicose vein. Most important thing is not the numbers, but important thing is that we got a lots of blessing from the patients by preserving their knee joint from the surgery. So common prediction for me, many people told me that you will not survive, but I survived. I not only survived, but I thrived also. Who will send you the patient? This is a very common word from my ex-partner also, but highest number of patients treated by us. In era of this 𝙂𝙧𝙚𝙀𝙗𝙗 and PMJY, this treatment will not work, because in PMJY the knee replacement surgery is almost free. All the expenses will be taken care by government, but it worked. And this very common thing, you will fail. Yes, I fail in many treatments, but failure has taught me the new way to success. So when I look back my journey, and I just think that why all these negative comment didn't work on me, because my hunger to do something new and to satisfy my hunger, I am ready to see as a foolish. So my dear my friends, take risk in your life, and it will be definitely helpful into your future to build your career. So stay hungry, stay foolish. Thank you.